Bobby Ramesh. First of all, welcome to Wellbeing Voices. Bobby, you and I have known each other for a while, and it's first of all a compliment and a privilege to see someone who's bringing the grace to the profession of nursing. So thank you so much for what you're doing. It's
My
very awesome.
pleasure.
And Bobby, when we talk about leadership and when we talk about leadership in healthcare, the first thing that comes to mind is either a doctor, who's typically a HOD or a chairman of a department, or a administrative side, the CEO and COO, CIO of the hospital or the healthcare institution that we are talking of. Very seldom does the conversation move to somebody who's like a chief nursing officer or somebody who's leading that particular segment in the healthcare delivery institution, despite the fact that they spend the most time with the patient? They are the ones who are able to report the challenge that could be happening real time with the patient. They are the ones who could sense the emotion of the patient at that particular point in time, whether it's the emotion of pain, emotion of being well looked after, or the need to just speak to someone. Why does the chief nursing officer or the nursing head does not come to the forefront of thinking when you're talking of leadership?
Thank you, Mr. Nalla, for making me part of this show. And as you rightly said, in most of the hospitals in our country, nurse leaders are not in the forefront. They work from back end. I feel the reason may be mainly due to the hierarchical, especially the patriarchal hierarchy in our society, wherein most of the nurse leaders are ladies. Of late, the trend is changing that more male staff are also getting into this profession for better career opportunities. Unfortunately, unlike the West, in India, nurse leaders are not given that position or importance, though nurses are being with the patient 24 by 7. And nurse leaders, be it a nursing superintendent or a chief nursing officer or a director nursing, they command or they take care of a whole group of nurses, which is at least 40 percentage of the manpower in their hospital, 40 to 50 percentage in many of the hospitals. While the doctors are in command in most of the hospitals, except very few, maybe a breach candy where nurses are in command. But most of the hospitals in our country, doctors are in command. However, nurses are the one who execute the care plan, being with the patient 24 by 7. And who can be a better patient advocate than a nurse who's with the patient 24 by 7, who understands the patient's problems and challenges better, and when the doctor comes on round, she can communicate better, and the whole treatment depends upon that. But this trend of not involving them or including them in the forefront, this trend is slowly changing actually post COVID. Though it is minuscule, but things are changing, and nurse leaders too are involved in decision making in boardroom meetings, mainly in corporate hospitals. This trend should change, and like in Western countries or even in the army, I studied from Armed Forces Medical College, Pune. In the military nursing service or in the Armed Forces Medical Corps, nurses are considered equally when it comes to rounds, when it comes to decision making regarding patient. Doctors do involve them. I feel sometimes it may be due to the lesser level of attrition and the way they are trained. Unfortunately, in our country, the training levels across various types of organizations are different, and the attrition levels are more, as you know, 40 to 70 percentage is the attrition level among nurses. They fly abroad for better opportunities. So even the doctors are not that confident when they think of the competencies of nurses. But things are changing, and I'm sure and I'm positive that things will definitely change for the better for nurses. Even in my group of hospitals in Faridabad, I had been appointed as a group director nursing excellence. That is a good change, right?
Absolutely, absolutely. I mean, just putting the term nursing excellence just makes it more meaningful. And Bobby, you said that the attrition is 40 to 70%. Now that's probably the highest that I've heard in any industry, right? And you said that they're going abroad. Is it only the money that is attracting them there, or the challenges in India around nursing are beyond the money?
Most of them are going for money purpose. Even some of them have told me, even the basic salary what they are getting in India, if they get double of that, many of them don't even want to go to places like Saudi Arabia, where restrictions are more for nurses, even in terms of their dressing up and everything. They say if we get at least double of what is the basic salary, basic is 20,
Right.
20,000 you get a basic salary, and if you get a 40 also, many freshers are willing to stay back in our country. Even the Supreme Court has said that the basic salary need to be revised. And some of them go definitely for better career opportunities. In India it is mainly traditional way of working. From a staff nurse, you become a senior staff nurse, then you become an in charge nurse. That is how you are, then you become a nursing supervisor, then you become a nursing superintendent, that way. Whereas in Western countries, these nurses have an autonomy to practice. They can choose their schedule of work or shift of work. Here, irrespective of whatever their concerns, whatever shifts they are put in, they have to follow morning shift, evening shift, and night shift. Somebody having small kids, they may not want to do a night shift. Somebody having some family problems, they may not want to do a morning shift. So there they have options to choose the shift they work, and they give their appointments, or they work in different shift in different hospitals, and not more than 3 days or 4 days in a week, and they get 3 days off, and there's a better work life balance. And nurses can do courses like nurse practitioners course, and they can have their own clinics. One of my neurologists was telling, in the UK he was practicing as a headache specialist, and his headache nurse who's assisting him, and she has her own 2-3 clinics, and she earns better than a doctor. So these all options and opportunities are there, and choices also are there. So that is also a reason why they leave. Yeah.
So it's also, it's not, money is the primary objective, uh, but when you say that they're okay to work in India if the money is doubled and not even matching what the international offering is, but clearly they're more than this. There is more than this reason for which they wish to go abroad. The opportunities that they could probably, and the respect that they could,
Empowerment.
empowerment. You know, when you're talking of nurse practitioners, you know, clearly the upskilling and the training and development out there is something probably that is leading them to take up that particular career. What are the challenges or the gaps that are there in the skilling, upskilling, or the training and development for nurses in India, where, because I'm sure for a hospital it is a big thing if the attrition rate is very high, and they would bend backwards to retain good nurses. Is there a gap in training and development that we are not
Definitely.
able to develop these nurses to a point where they become so attractive to hold back by the hospital?
Definitely, there's a lot of gaps. See, a nurse after finishing a diploma in nursing, which is 3 years, or a degree in nursing, which is 4 years, they opt to work as nurses at the bedside without doing any other course. Either they go abroad or they continue to work here. Whereas there are around 16 specialty courses which are available in the state nursing councils. 1 year diploma in nursing, in specialty nursing, pediatrics, oncology, orthopedics, obstetrics, psychiatry. Like for doctors, you have specialty nursing courses, but no takers for that. They
Why is that?
think we take this course 1 year, we go without salary because it is a full time course. So 1 year you may be the breadwinner of your home, and you have to do this course, you will not be earning. And many of them study with educational loan, and when they are working as staff nurses, they have to repay their educational loan which they have taken during their student time. And after finishing the course also, they are not given any much of salary difference between the
The
others.
increment is not that much.
So whether there's a general nursing or a master's in nursing candidate who has done their degree and come, the hospitals do not have defined criteria to pay them better. For example, an MBBS doctor gets a lesser salary than a specialist doctor. A specialist doctor may be getting a lesser salary than a super specialist doctor. All that is benchmarked across private hospitals in the country. But for nurses, there is no such benchmarking. Hardly there may be 1,000 or a 2,000 difference, and some hospitals do not have any such difference. Then they feel that I spend so much money, 6 to 8 lakhs they spend for a degree course in nursing. I spend so much money, what is the use?
But tell me one thing, Bobby, I mean, if this is such a big area of concern, why aren't the hospitals taking notice of this and trying to do things differently?
Hospitals, many of the corporate setups and even standalone hospitals are taking notice of it. Even in my hospital, we have rolled out critical care nursing module in-house. In-house critical care nursing modules, in-house oncology nursing module, in-house upskilling modules for the nurses, so that the nurses working in that particular unit, specialized unit, let them be trained internally by the doctors and the nursing education team, and they get a certification of completion, so that they'll feel satisfied, and to certain extent we can, and we will definitely revise the pay packages based on their performance and the competencies. So that way we can retain also the staff, and we can control the staff attrition. In my hospital, Sarvodaya Healthcare, our attrition rate per month is only 2%.
Wow, as
From
against the
4 to 40 to
40 to 70%.
70%, it is only 20, base is 20% is the attrition, because so many such training modules, so many such measures we have put in places for staff welfare, that hardly people leave the organization.
Fantastic, fantastic. And Babaji, what do you think? You know, your hospital, I know because with the kind of motivation that you have, your own standing and the buy-in of the management. But otherwise, at the industry level, what are the kind of changes that you expect to happen, both from the hospital leaders' perspective, the senior nurses, their contribution in bringing this change, and also from the policymakers, so that you know the industry goes through a change, recognizing the effort of a nurse, compensating them for their efforts, and ensuring that we are able to retain good talent in our country. Because even when a person leaves and you are able to hire new people, but there is a cost of training, there's a challenge in hiring new nurses, the whole process is cumbersome. What do you think needs to happen?
Absolutely right, Mr. Narula. Definitely policymakers have to think about it, and while drafting policies, nurse leaders from both private and public sector have to be included. Recently we had a roundtable discussion in Delhi, wherein the Indian Nursing Council president and the founder of Digital Health, um, Academy of Digital Health, Dr. Rajendra Pratap Gupta, they had organized for a roundtable just to understand the concerns from both public as well as private hospital nurse leaders, so that they can submit a white paper to the government. So whenever there is a policy making or a roundtable discussion, nurse leaders from both private and public hospitals need to be included, because both the setup, the challenges are totally different. In public hospitals, though they are qualified, though there are vacancies, those vacancies are not filled. People retire as an assistant nursing superintendent or an assistant principal, officiating as a principal or officiating as a nursing superintendent. The posts are never filled, and people are being taken only on contractual basis, and so the challenges are totally different. Private hospitals, the basic challenge is the salary. Government hospital salary is not a challenge. So even Supreme Court had mentioned about revising the salary of nurses. So revising the salary, there has to be some benchmarking at staff nurse level and based on the qualifications also. Secondly, at the hospital level, all the hospitals have to think of upskilling their nurses, not only depend upon the nursing council modules, they should also start their own modules internally, or standard modules. Organizations like AHPI can roll out standard modules. Already one module on nursing excellence, essentials of nursing excellence, AHPI is having. So specialty modules can be, infection control module they are having. They can roll out modules which nurses can attend as per their free timing. It should be flexible because everybody does 3-shift duties, and they should be upskilling modules have to be introduced by various organizations or bodies, and nurses should have the options to pick up not only from within the hospital, even outside. It should be authentic, and it should be standardized modules should be available. And from the nurse leaders and the staff nurses perspective, I feel when we talk about having a better salary, it is when we have that expectation, it is our duty also to upskill ourselves, to be more competent, to be well versed with the latest updates of what is going around in healthcare, not only in nursing. Unfortunately, most of the nurse leaders, they confine themselves within that nest of nursing alone, and it becomes like they work in silos. They don't attend various healthcare conferences, and they don't interact much. The interdepartmental or inter-team collaboration with other specialities, be it with doctors or operations, you need to learn from them also and keep yourself updated. This should be their contribution from themselves, so that tomorrow you can always say, I need this because I am competent, I am privileged, or I have these competencies, and you can demand or command for your position or salary. Believe me, I as a director nursing, wherever I have worked, I have been treated at par. Wherever I worked, I have had my empowerment. All that I feel I owe it to my training and my teachers, and the way I have groomed myself over the period of time, and I have taken also effort in updating myself. So people treat you at par. So every nurse leader should be taking it on priority in grooming themselves and to update themselves with the latest happenings. Yeah.
Robiji, this is a very, very important point that you brought up, because this is also my observation. When you go to a hospital, the nurse may be competent, but they lack confidence, right? So they don't see themselves at par with other people. How do we change that? And also, while you're answering this, another uh, observation of mine is, when I've interacted with the industry, is that technology of today, the tech advancement that we are seeing, the new medical equipment that has come in terms of monitoring, can really bring or build efficiency for the nursing staff. But I've seen nursing staff feeling feared that their job is at stake. You know, why is this fear there? Why are they thinking that their jobs are going to be taken away, whereas the technology is there to help them, support them in doing their job better, to ensure that the errors are minimized and nothing which otherwise could be missed by the naked eye is something that they don't miss in their work. So why this lack of confidence and why this fear?
I feel maybe due to lack of training. If they are introducing a new technology in the hospital, it is the duty of the management of the organization to train or to send the identified nurses for the training of that technology. While doctors are, it happens in some places, it doesn't happen in some places. For example, if a new robotics is introduced, doctors are trained, doctors are sent to even foreign countries. How many hospitals send their nurses to foreign countries? Be it in oncology, latest CAR T cell therapy and so many other latest advances are there. Doctors are always going. Either hospitals sponsor them or the company sponsor them, which is introducing this new advancement or technology. But hardly hospitals send their nurses for this. And when it comes to the hospital, by default, then the nurses have to assist the doctor.
Right.
So maybe because of the lack of awareness, the lack of confidence, nevertheless, many hospitals do train the nurses internally on this new technology, so that non-nursing jobs can be reduced, starting from a simple call bell. Everybody feels call bell response is the nursing KRA. A nurse has to attend the call bell. Even if 10 people are sitting in the nursing station, nobody attends to the call bell. And poor nurse who's taking care of 6 patients in the ward, she may be busy with the patient, she has to come, then rush to the patient, then the patient will shout at her, why are you late? Anybody, it may be for a glass of water. It may be for a food related issue, it may be for a maintenance. So some of the hospitals definitely have call bell for nursing and call bell for non-nursing. So as simple as having a different call bells for different services, it will ease out the job of the nurse.
Absolutely. This is brilliant because these are small, simple ways in which you can make a difference, and there are no, I mean, there's not a huge investment in doing all this.
And while I was at Apollo, Hyderabad, everybody, the hospital culture was such that everyone, be it the doctor or the nurse or the operations executive on the floor, were trained. If a call bell rings, anyone there should attend. There was no differentiation between a doctor or a nurse or an operation executive because our first objective is to attend to the patient. So, such culture should be developed across hospitals, and nurse call bell, the nurse name should not be there. It's a call bell for the patient's requirements.
Tell me one thing, Bobby, in your long, meaningful career, uh, and now taking on the role of a nurse leader, what has been the most fulfilling moment for you uh, in your career, which gave you a sense of fulfillment that I'm in a beautiful profession?
Thank you for asking that question. 10 years I was at the bedside as a bedside nurse. The most satisfying moment has come when a patient was critical whom you were taking care in the ICU, goes out of the hospital hale and hearty, and they remember you, and you feel so happy for them. Also, I worked in the labor room for and neonatal ICUs for a long time. When a baby is born, and even in the NICU, preterm babies, 600, 700 gram, they are there with you for 2 months or 3 months. They get attached to you. When you hear their voice, when they hear your voice, they stop crying. And when they go, when they put on weight, they recover and go, you feel happy as their parents. So this was my job satisfaction when I was a bedside nurse. Then I was a teacher and a principal. Definitely when my students come out with flying colors, and most of them are well placed abroad, many of them in UK, US, or as Australia and Canada and Gulf countries, and they do keep in touch with me on Teachers Day, sending me such touching beautiful messages. I feel so very happy that as a teacher, or as a principal, I could do my bit for my students. And now as a director nursing, for the last 10 plus years I am a director nursing in the best of the hospitals, starting from Jaslok Hospital, Mumbai, to Apollo, Hyderabad, to Continental, and now at Sarvodaya Healthcare. If you see in the conference also, many of my junior nurses are now nursing heads of various hospitals. When they say those few words, and when they come and meet you with affection, and they say that you brought about a change in my career growth, that gives you a lot of fulfillment.
And Bobby, most nurses, male or female, are very young people, you know, and they, for the sake of the profession, their work environment is such where there is high pressure. They are dealing with a lot of sadness around because everybody that they're serving is unwell, in pain, they've just gone through surgeries, uh, different emotions. How do, what is it that you could do as a nursing leader for the industry where these young people don't miss out on joyfulness, happiness, their smiles at this young age?
As you rightly said, in India, the average age of a nurse is around 22. Unlike in the UK, maybe where it is 40 or a 42. Here, these young ages are so vulnerable, facing sadness, aggressiveness of patient relatives, the doctors, all that, it leads to tremendous pressures. Based on the scope of services, the more the scope of services in a tertiary or a quaternary care, the more stress level on the nurses. So wherever I worked as a nursing head, I made sure that apart from their regular training, we have such stress buster activities at least once a week. At least once a week we have stress buster and team building activities where they enjoy during that 1 hour. And every monthly we have this town hall meetings wherein they can share any concerns they have. It's an open door policy, and the nursing head is interacting with all the junior nurses there. What are your concerns? How can we help you? And how can we make their life better? And whenever they have, and we have counseling systems everywhere, we have counselors. If we feel something is wrong, or if they themselves come and share, we direct them to the psychologist or the counselors, so that they can help them, and sitting through those therapy sessions they feel better. And rewards and recognitions, definitely in my hospital every month, whatever appreciation has come from the patients or the doctors appreciations for nurses, that many certificates of appreciation we give to our nurses.
Amazing.
Every monthly this is, and on the annual nurses day, the one who has got maximum appreciation, will be giving them first, second and third. Across hospitals where I worked, I have implemented it.
Bobby, my last question to you, and it is coming out from what you just said. You know, we are recognizing them based on the feedback of the patients, doctors, etc. But this also creates a lot of pressure on their mind to be able to prove themselves that they are worth appreciation, right? But with the kind of pressure that they have from their medical faculties that are there in the institute, and also the patient and the patient's family, and these are young people who haven't seen life yet. Uh, are there issues around them being exploited? Are there issues around their security uh, that have come about in India? And if so, what is it that we are doing to address these concerns?
So definitely staff would have come across, they are vulnerable to that also, security issues, and they are vulnerable to various such issues across hospitals, not only in our country, even abroad. That is why hospitals, at least the accredited hospitals in our country, they have this committee, a grievance committee and a POSH committee or internal complaints committee. They definitely have it, and the nurse leaders and the HR leaders take them into confidence. If they have any such issues, they are free to report such concerns, and during induction itself we train them. They should not tolerate, zero tolerance to all that. Any such things happening with them, they need to speak up, and they are under so much pressure. I do understand, but nursing is a different forte altogether, dealing with the lives and deaths of patients. So these 3 years or 4 years, they are trained and molded accordingly, and our Indian nurses are the best abroad also. So our training system is the best. So they are trained in good organizations or reputed colleges. They are trained accordingly, though they are 22 or 23 years of age, they can handle. And those who are not feeling that confident, I would say that this soft skills training, be it at staff nurses level or at senior nurse leaders level, everyone should have soft skill training so that they can handle people and situations better.
Absolutely. Uh, as Bobby Ramesh, it has been such a beautiful conversation because I think we need to have more conversations around nursing, and not just nursing but paramedical staff, etc. Which without their support and without their contribution, I think the healthcare delivery system would completely collapse. And I think their work is not as much recognized uh, in the public domain as it should be. And I think the work that you are doing to bring attention to this, to bring attention towards training, their attention towards uh, soft skill training to make them confident beyond competence, it's a big contribution that you're making. Really appreciate what you do, and thank you so much for speaking to us at Begging Voices.
Thank you so much, Mr. Narula. Before I conclude, I just wanted to add two things. One is that, like as you said, like any other specialty, like a doctor, like a operations head, like a IT head, nurses also are expert in their area. So they have to be treated at par.
Absolutely.
This hierarchical differences should change. Nurse practitioner course in the country was rolled out at least 8-9 years ago. Some, though it is approved by the Indian Nursing Council, some of the universities have approved and supported, whereas some of the universities say that why nurses have to become nurse practitioner, and how they can take care of patients independently, what they will do. Doctors are there. So some of the state universities have not given approval till date, whereas some of the states in our own country are running these courses on nurse practitioner in critical care very successfully, and midwifery as well. So this, should change. If something is rolled out from Indian Nursing Council and something is approved by the government, it has to be allowed to be rolled out uniformly across our country. And thank you so much for inviting me to the show. It was a pleasure meeting you again.
Thank you so much. Thank you so much.
Thank you.